A new report finds suicide rates in Southeast Ohio are among the highest in the state. Here to talk more about how local organizations are addressing the problem, Robin Harris with the Gallia Jackson Meigs Alcohol, Drug Addiction, and Mental Health Board. Thank you so much for joining us, Robin. Now, what are some of the major causes of suicide that the board has pointed out over time?
You know, that's a difficult question to answer. There are as many variations in how the human brain responds to circumstances, how we react to the environment around us, as there are the variations in human beings. So that one is difficult beyond answering, of course, the obvious signs of depression or a traumatic event, but we're finding that there just are myriad causes.
Yeah.
What we're seeing.
And why do you think the rates are so high in Southeast Ohio?
And that's something that we are really only beginning to study. Cultural factors and stigma have kept us from being able to take a real deep dive into what happens in the life of an individual. We know things such as cultural beliefs about not seeking help outside the family, social isolation, factors of poverty that permeate Appalachia certainly have a strong impact on that. But we also are in the process of studying individual cases and trying to identify trends, even mistakes we may have made in what we assume to be the causes. And the causes can vary, but what are some of the resources available for these people and families in the region? We're casting a wide net with that. The state of Ohio has started a 988 national suicide hotline, and for this area, it's actually answered here in Athens. And by trained counselors. We also have the crisis text line, which a person can text just the word "for hope" to 741-741. And again, a trained counselor will come on and text with the person, lead them through the process of kind of identifying their crisis and direct them to local resources. We also are doing training in schools, in faith communities, in community organizations about signs of suicide, how to respond if you believe that a loved one is in trouble. And then we have developed this resource guide that we are putting in hair salons, bars, food banks, churches, any place where we can find people where they are.
Yeah. That's amazing. And what plans does your organization have now to tackle suicide rates in the future?
We are doing a two-prong. What I just explained to you about educating the public, helping people understand where resources are available. We're also simultaneously doing a really deep dive into cultural factors. We've started in all three of the counties that we serve suicide review boards, where we are going in and looking at all of the factors around each individual case. We also have individuals that we've trained within our behavioral health system in what we call psychological autopsy. As the stigma is reduced around being able to talk about suicide, we're able to come in and support families, help them through the very complex grief, and begin to understand and potentially point out trends that we may not have seen before that will lead to more effective intervention and prevention.
Well, this is a very complex topic, and thank you so much for the insight that you've given us. We appreciate it. If you want to learn more about the resources provided by the Gallia Jackson Meigs Alcohol, Drug Addiction, and Mental Health Board, visit new.gjmboard.org.